Afternoon. It is 2 p.m. and welcome to Cook County Health Department School Health Webinar for the month of February. My name is Kelly Jones and I am a health educator with Cook County Department of Public Health, and I host and facilitate these meetings. Thank you so much for joining. Let's get started. Forgive me for not being on camera. This change in weather hit me hard this morning. I woke up feeling like someone threw rocks in my throat, so I'm going to stay off camera, but thank you. Our agenda for today is we have some announcements, resources that we want to share, and also we have our CCDPH communicable disease update we do monthly. We have a representative from Orland Park Township to talk to us about their vaccination program, and Kathleen from Cook County State's Attorney's Office of Internet Crimes wants to talk to you guys about an initiative she's developing, and we have a teen dating violence presentation from the Crisis Center of South Suburbia. We have a jam-packed meeting this month. Let's get started. Our objectives for our webinars are to keep you all informed, give you the most up-to-date information and guidance to navigate any school-related issues related to health and wellness, share resources, and provide community support. Our webinars are recorded and they're uploaded to our school health page on our website as well as our YouTube page. And all of the slides will be uploaded to the website as well, so you can download them at your leisure. I used to email them out, but they got too big and too much to email, so now they're uploaded onto our website. Few announcements. Registration for our series of monthly webinars are updated and the registration is on our website. You can scan the QR code to find that link. And also the second link is for our monthly school health newsletter that will go out within the next 2 weeks. Information that we have at these meetings, in addition to more information community related to school and community health, will be added to the newsletter. So if you're interested in that, please sign up for that newsletter. We are thrilled that the Epilepsy Foundation of Chicago will share seizure information and school resources at our March meeting. You can scan that QR code to register for the March meeting. I have to profusely apologize because Hartgrove Hospital was supposed to send out the CEUs last month. I got a few emails. I'm sorry, I was off last week, but I got a few emails saying that they still have not received the CEUs, and I apologize profusely, and I will contact them and see how we can facilitate this. I know it's been a ridiculous amount of time since we've had the conference. It's out of my hands, but I will stay on them and make sure that we get those to you guys, because this is not how I do business. So I profusely apologize for that. Here is CCDPH's contact information. If you have any webinar related questions or general questions, if you'd like to report line lists or report anything to the communicable disease unit, there's your information, as well as our general website, our school related website, and information on how you can secure prescriptions from Cook County. CCDPH hosted data ambassador workshops a few months ago. It was teaching those community members who register how to access data in order to enhance their programs. Specifically, if you were doing grants and you wanted to get some data to back up your grant applications, etc., this is a useful tool. You can scan the QR code for the toolkit, so those who did not register and wasn't able to attend can still access that information and learn how they can leverage that data. As I mentioned before, I am no longer that contact for the prescription requests. You can email the email address that's on the page for any school-related prescriptions. I still have a few people that email me, and I am happy to give you the email address if you do not have it handy. So no problem. You can always contact me if you have questions regarding that. Schools who are automatically opted into the Rescue Illinois program should reach out to Rescue Illinois with any questions or concern. Schools who were qualified automatically received EpiPens and albuterol resources, and they can contact Rescue Illinois if they have any questions about that. Denise Holman, who used to be our Narcan representative, is no longer with CCDPH. We wish her well. She moved over to the hospital side for another position. So for all of those requests, you can send them to Jessica Yee, who is the community engagement manager, and Jessica's information is on that slide. CCDPH restarted their vision and hearing program September 2024, and they have slowly rolled it out. And they were starting with ages 3 and 5, and we're planning on expanding it to school age children. But you can reach out to them to schedule a vision and hearing screening for your school or even for your community event. CCDPH is hosting free flu and COVID vaccination clinics until next month. We're trying to do them every Saturday, so the information is on the slide, and you can also find that information on our website and our social media channels. We'll have a representative later on to talk about this in more detail. Let me mute this person really fast. In more detail, but the Village of Orland Park is now a vaccine for children provider, and they're offering vaccinations to all in the Chicagoland. And we'll hear more about that a little bit later in our webinar. Also, a great resource that I discovered, Harper College has a dentistry unit, and they are hosting a free kids dental clinic in April. It is free. There is limited space available. They told me they have limited staff and limited space. So it's first come, first serve. You can scan to register, and they're only doing routine clinics at this time. However, they sent me more information, more detailed information will be in our monthly newsletter. But outside of the free clinic, then this is information on other clinics that they are hosting. And they also see adults only for minor things such as cleanings. They don't do extractions or anything like that, but it's very low cost and it's a great resource. It is the time to try to secure your mobile vaccination resources for back to school. Seems early, but they book up very quickly. So if your school or organization is trying to host a back to school event and you'd like to have vaccinations there, this is the time to secure those resources. Few mental health resources. They're pretty much the same every month. We want to make sure that everyone is aware of the resources that are available. You can call, text, or go online to 211.org. It's a nationwide resource for the community. And then I'll just slide through these. This is updated. NAMI's winter program started in January, and they go until March 11th for families in Winnetka and Skokie. And also they're having an upcoming Chai and Chat. It's a mental health wellness circles for South Asian community, and they are virtual, and you can scan to get more information on those upcoming events. I will quickly slide through the rest of our resources, only highlighting those new resources that we've discovered. I believe I mentioned this last month, but Governor State University is offering a free beginning ESL training program. If you have any families or parents who could benefit from this, you can get that information off that slide. Current or former in-care youth for DCFS can qualify for a DCFS scholarship. The deadline is March 31st. In addition, here's some more information on upcoming scholarships. This is sponsored by the Coalition to End Homelessness. And I just want to share the many community offerings that CETA has. In addition to, we know them mostly for, utilities, but they offer eyeglasses and other resources to the community. Our partners from the Greater Food Depository share information on accessing food resources. We know this is a hot topic nowadays, and people are food insecure more now than ever. Information on some upcoming and current pantries within Maywood, the South Side, and the South Suburbs. And here's also a QR code with a list of more pantries. If you know someone in your community or in your school who is clothing insecure, there are clothing, shoes, and toiletry pantries coming up. You can scan the QR code to get more information on those pantries. And I'll just scoot through these events. 7 Generations Ahead is sharing a zero food waste school webinar that will be on March 17th. Information is on the QR code. I'll leave it up for a few seconds if you guys would like to scan and attend this webinar to learn more about how you can have zero food waste in your schools. In acknowledgement of Teen Dating Violence Month, Zeta Phi Beta Sorority Incorporated is hosting a Know Your Worth workshop. I believe this is Sunday. from 3 to 5. Again, you can scan the QR code if you like, or take a picture of the slide if you'd like more information. Commissioner Donna Miller is sponsoring several CPR trainings. The one in Country Club Hills was canceled, so this is the updated flyer. They're all free, and then you can attend at the various locations. In addition, we're all feeling stressed out these days, right? So next week there is a Find Your Calm, beating burnout and reducing stress event that is from 6:30 to 8:30, 8 o'clock. I need to attend that. How about you guys? More information on free CPR classes. And Congresswoman Robin Kelly sponsors this large youth opportunities fair every year, and it has opportunities for summer camps, for jobs, for other opportunities for youth for work and education. So it's well attended. So please share the information. Bloom Township also has a summer employment program that you may have some youth who are interested in, an upcoming youth summit. And we are happy to move to the point of our communicable disease update, and I'd like to welcome Avi Joseph to give our CD update. Hi, Avi.
Hey, Kelly. Thanks. Are you able to move my slides forward?
Sure can.
All right, thank you. Uh, um, yeah, so we're gonna start with, as we usually do, going into respiratory disease. You can go to the next slide. Fortunately, things have really slowed down in the last month. You can see that COVID and flu activity has gone down to low. We have seen a bit of an uptick in RSV in the last couple of weeks, so we'll definitely be focusing on that. But definitely feels good to know that it seems like the worst of our flu season, which had gotten pretty bad, seems to be over. Can go to the next slide. Here's the percent of ED visits due to RSV. Like I mentioned, we did see that uptick of RSV going from a low level to that medium level. And we have kind of finally passed the percent of ED visits due to RSV that we were at last year compared to this year. Um, you can look at that chart on the right and see the split by age group, and you can see that RSV is disproportionately impacting our youngest kids, age 0 to 4, which is kind of expected. But I do just want to remind everyone that RSV, at least in infants, is now kind of a vaccine preventable disease. There's a maternal vaccine available to expecting mothers who are going to give birth kind of directly prior to the respiratory season. And there's also a vaccine available to infants under the age of 8 months. You can go to the next slide. And then again, looking at RSV test positivity, that number has also continued to increase, and you see again that we are above where we were at this point last year. That chart below is looking at counts of influenza by subtype. Like I mentioned, it does seem like the worst of our flu season is over, but if you can kind of see that we've seen a slight increase from the previous week to this week, and um, that is kind of caused by more influenza B. We do tend to see more flu B later in the season, and flu B does tend to impact children more. So definitely something we still kind of want to keep an eye out for the remainder of the season. Can go to the next slide. And here's our percent of inpatient admissions due to flu. So just I just kind of wanted to call this out because it's kind of a just crazy peak that we saw. I think I'd mentioned in a previous presentation that last season was actually quite a severe flu season. But this year you can see that we peaked well above the peak of last season, but it does look like we've kind of continued our decrease. And did just want to kind of call out that we have seen kind of a bit of an uptick in flu in 5 to 17-year-olds in the past couple weeks after that pretty steady decline. So again, just something that we want to keep an eye out, especially as flu B starts to become more prevalent for the next month or so. Can go to the next slide. Um, This chart is just looking at the count of ICU admissions due to COVID. Our COVID season had been relatively mild, but you can see that we've started to see a little bit more activity in terms of ICU admissions, and it kind of almost seems that a greater proportion of the hospitalized cases that we're seeing are having to go to the ICU. So even though this hasn't been too severe of a COVID season, it's still definitely having an impact in our community. You can go to the next slide. Um, can go to the next slide. Briefly just wanted to talk about pertussis or whooping cough. So pertussis counts actually really decreased during the pandemic, along with a lot of other respiratory diseases. There's actually a strain of flu that went extinct during the pandemic, just kind of due to the mitigation measures that we had in place, social distancing, masking, decreasing large gatherings, all of that good stuff. But since kind of the pandemic ended and those control measures kind of went out, pertussis case counts have really skyrocketed. 2023, there were around 7,000 cases reported in the US, and in 2024, that jumped up to 35,000. 2025 numbers are still provisional, but I think I saw that CDC had reported that we're at a little bit over 28,000. As we know, pertussis disproportionately impacts children. You can see on that graphic on the right, just some of the other demographics that get impacted by pertussis: pregnant women, close contacts, immunocompromised folks, the elderly. But you know that we definitely see pertussis cases and outbreaks in our school settings. So definitely want to encourage parents to adhere to that pertussis vaccine schedule, which is, you get the DTaP at 2 months, 4 months, 6 months, 15 to 18 months, and then 4 to 6 years. And then you get that Tdap at 11 to 12 years. And that's the best way to prevent pertussis infections and outbreaks. And if you do have, a case or an outbreak in your school, definitely reach out to our communicable disease team, and we can help kind of um, institute those control measures as soon as we possibly can. You can go to the next slide. I think that's all I had for this month. Things have slowed down, knock on wood. So that's my contact information. And if you do want to get added to our weekly respiratory list, you can email my colleague Courtney. I'll stick around a bit in case anyone has questions, but otherwise I will pass it back to you, Kelly. Thanks.
Thanks, Avi. That was great information. I know that you guys are glad that things have slowed down because it was a little hectic a few months ago. So I'm sure that's good news for you. And I would like to welcome Miss Amy Haddad from the Orland Park Township, and she's going to talk to us about some upcoming resources that Orland Park has for the community. Hi, Amy.
Hey guys, real quick, Kelly, just to say thank you for having me on. I appreciate it. So yes,
No
I work for
problem.
the Orland Township organization, and then I just want to share pretty quickly, it won't take too long, about our immunization clinics that we have, which I just think would be a great resource for everyone in the Chicagoland area. So for the next slide, the Orland Township, we are part of the VFC program, which is the Vaccines for Children. So that's a federally funded state administered program. So we provide free vaccines to those who are eligible. You can see the guidelines there. So it's for 18 and under, if you have no health insurance or Medicaid enrolled, Title 19. The vaccines themselves are free, but we do charge a $15 administer fee per vaccine you get. But yeah, I can go to the next slide. Our clinics, we offer pretty much majority of the routine vaccines that you need for school. So again, we're a great resource if you know or can get the word out if people need their vaccines for school or even for infants. We do treat pretty much babies till the day they turn 18. So again, and then our clinics on the next slide, they happen once a month and they're by appointment only. So the appointment takes about 15 minutes. We're pretty quick. We have 4 to 6 nurses. They come in with the doctor. They do everything, which is great. Those are the following dates, but again, there's also a flyer on the next slide, along with contact information about how to schedule an appointment. Yeah, and then I think this is going to be uploaded at the end of this webinar, which is great. And I'll also stick around for some questions. But again, I think it's just a great resource um, if anyone's in need of their vaccines. So yeah, that's about it. Pretty quick, I know.
Thanks, Amy. This is great information. Does anyone have any questions for Amy before we move on to our next presenter? This is fantastic. Did I hear you correctly that it is appointment only?
Yeah, we
Okay.
yeah.
Sounds great. And yes,
Yeah.
the slide deck will be uploaded to our CCDPH website, and these flyers will also be put in our February newsletter, which will be coming out in the next couple weeks. So if you have not signed up for that newsletter, there will be a QR code at the end of our webinar. You can sign up for it and make sure you get all this information and these resources. Thank you so much,
Yeah,
Amy.
thank you
This is
guys so
great
much for having
information.
me.
No problem. Thank you. I want to welcome Kathleen McGowan, one of our fantastic community partners. Kathleen is with the Cook County State's Attorney's Office of Internet Crimes. Hi, Kathleen.
Hi, how are you? Thanks for having me. So I don't know where my background is, but I wish I was there instead of my office right now. Um, so I just wanted to touch base with everyone to let you guys know something that actually popped out from the conference last October that Kelly had invited us to speak at. The nurses we spoke with had talked about wanting more resources for information about internet crime children, how to work with the kids. They mentioned that sometimes when the students come in with headaches or stomach aches, a lot of those are stemming from issues they're having online. So, what we decided to do was to plan a sort of training discussion afternoon for right before when school starts next fall. So we're currently working on that. And what I'm hoping to do is get input from all of you as to what sort of things you're looking for. We know what our basic trainings have, which are the laws around the cases we do, what types of crimes we investigate, how to talk to students when they're having issues, what the court process might look like, and just what kind of things we can offer to all of you. And hoping in the end that might take a little stress away from your interactions with the students. So what we're hoping to do is have one training north and one training south. If we get enough buy-in and interest, we might do one in the middle somewhere. We're thinking maybe a 2-hour training in the afternoon or in the morning. And that's one of the reasons I had talked to Kelly and asked her if I could hop on real quick today, because what I would like to do is send a little survey out to anyone who would be interested in helping us out with some questions we have as far as what hours work best for all of you, what type of things are you looking for that we might not have in mind since we don't do your job. Um, we want to make sure that whatever we're tailoring this to, it's going to include you and not just be what we want to bring out. So I will put my information, my email in the chat as soon as I'm done. And then we can also kind of go from there. So again, we're trying to do this in August. Either right before school starts, or I'm sure you guys want to get paid for coming, so we'll do it when school starts. um, and just kind of find out what works best for everyone. If anybody, like I said, if you have topics you want us to bring up, somebody that might have, you know, something they want to say when they're there, that's perfectly fine too. Right now we have myself, I have two officers, one from Willow Springs, one from Summit, and I think I'm going to wrangle in either Arlington Heights or Hoffman Estates. And then one of our assistant state's attorneys, Marcel Taylor, who was at Moraine with me last October. So thanks for letting me let you guys know. Kelly's going to also help me get some information out in her next school newsletter. So we'll have that there as well. And hopefully we'll see you guys there.
Thanks, Kathleen. This is great.
Sure.
And of course, I'll be there to help with anything you need. And just, you probably couldn't see the chat, but Maria Elena, who is also another fabulous community member, is out of the Proviso Schools District, and she offered a location if you are interested in a
Oh,
location in the middle.
beautiful. I'm
So feel
sure we
free to
will
put your
take you up on it.
information in the chat. Sounds great. Thank you
Thank
so much.
you so
Any
much,
more
everybody.
questions? Any more questions for Kathleen? Feel free to put them in the chat if you think of
Okay.
something afterwards. But I would like to welcome
Thank
our
you.
esteemed presenter, Melissa Stans, who is with the Crisis Center of South Suburbia. As we mentioned before, February is Teen Dating Violence Month, and we're thrilled that Melissa can talk to us about programming. You have the floor, Melissa. Welcome.
Thank you, Kelly. Hi, everyone. I hope you're having a great Friday. First, I want to start off and I want to tell you guys a little bit about our program here at the Crisis Center for South Suburbia. We were founded in 1979, so we've been around for about 47 years by Diane Masters. Diane Masters actually tragically lost her life at the hands of her husband. So this was obviously something very near and dear to her heart, and we continue on in her legacy. Um, we offer a lot of services at our agency. Immediate safety through our emergency shelter. We also offer services to help victims gain independence and enable children to learn how to process the violence that they've been experiencing, at such a young age. We are open 24 hours a day, 7 days a week, 365 days a year. And all of our services to our victims are free of charge and confidential. In addition to our emergency shelter, we also have housing services, victim services that include counseling and court advocacy. We offer outreach services and we have a domestic violence hotline. We offer medical screening, which is our Live Safe program, law enforcement and victim outreach, which is our LEAVE program, and community education. Our prevention services include partner abuse intervention programming, which is our PAPE program, and the Safe Start program, which is what I'm here to talk to you guys about today. And I am a Safe Start coordinator. I am one of the ladies that goes out into our local middle schools and high schools and teaches different sessions on healthy relationships, emotional accountability, just trying to create a safe and nonviolent future for our children. With all of those services that I talked about, we also own and operate 2 retail shops that are called Neat Repeats, and we have them in Orland and we have them in Worth. So, yes, thank you. That slide. I'm so sorry. So we're going to talk about the Safe Start program. The program's main focuses are to promote healthy relationships and to decrease the instances of teen dating violence. It is a free program that we offer to different schools. In a future slide, you'll see the 8 different presentations that we offer, and I can speak a little bit to each of those, what they consist of. And what we do is we work hand in hand with the schools to help make a better solution to the violent situation that we're in currently. Teens are starting to date, preteens are starting to date, and we want to offer them the tools to make healthy relationships, and not just dating relationships, but friendship relationships too. We see a lot of violence or issues with emotional accountability in regular friendships, everyday relationships. So we want to help to improve in the emotional accountability. We want to be able to help them identify abusive behavior patterns in others, but also in themselves. We're constantly talking about stopping and taking an honest look at ourselves to see if we do any of the examples that we talk about within these presentations. And we want them to be thinking ahead to what the possible consequences are to their behaviors and hope that that could help to deter them from picking a bad behavior or something that could get them into trouble or cause a lot of harm. Safe Start empowers students with the tools and confidence they need to build healthy, respectful, and nonviolent relationships, both inside and outside of the schools. I always explain to the kids that, when they go to school, teachers and staff are there to help make sure that they feel safe, number one, because without that safety, you cannot learn. And I feel the same way about relationships. If you are not in a safe relationship, you're never going to be able to reach those goals and dreams that you are wanting to aspire for. So if you can go to the next slide. So our Safe Start presentation, kind of a reason why some of these things even have to happen, why we even have to talk about these topics is, according to the CDC, 1 in 3 teens has been the victim of verbal, emotional, sexual, and/or physical abuse. And that can be in person, that can be online, that can be with different devices. It's really amazing the lengths that people can go through to harm another individual. Nearly 1 in 11 females and 1 in 15 male high school students reports experiencing physical dating violence in the past year. Nearly 50% of students who experience dating violence have reported that some of that abuse took place on school grounds. And usually this is where people are meeting a lot of the people that they choose to date, which is a great reason to have it in the schools, these presentations. The risk of perpetrating intimate partner violence is doubled. It's 2 times higher if you've witnessed it yourself in your childhood. If we go to the next slide. So teen dating violence, it refers to any intentional, psychological, emotional, physical, or sexual abuse that occurs between people involved in a romantic relationship. Dating violence can take place in person, online, or through technology. It's a form of intimate partner violence that can include the following types of behavior. So physical violence, any threats to our physical being, that could be hitting, kicking, using any type of physical force, or throwing an object at someone. Sexual violence involves forcing or attempting to force a partner into sexual acts or touching without their consent, including situations where the partner cannot consent. It also includes non-physical behaviors such as sexual images, sexting without consent, sharing inappropriate jokes in front of individuals. Psychological aggression is the use of verbal and non-verbal communication with the intent to harm a partner mentally or emotionally and to exert control over a partner. We're always talking to the kids about how this is not love. It does not matter how many times it is said. It is all about control. Stalking is a pattern of repeated unwanted attention and contact by a current or former partner. It causes fear or safety concerns for an individual, a victim, or someone close to the victim. And that's when we're talking about that digital violence. Teen dating violence profoundly impacts lifelong health, opportunity, and well-being. Unhealthy relationships can begin early and last a lifetime. When people are experiencing this type of violence, they have trust issues with, even with their friends, just being able to identify and maintain healthy relationships. So teen dating violence risk factors, they can, some individuals, some teens are just at a greater risk than others. Female students experience higher rates of physical and sexual dating violence. And students that identify as LGBTQ plus, or those who are unsure of their gender identity, also experience higher rates of physical and sexual dating violence. Teens often think some behaviors like teasing and name calling are normal, and that's a normal part of a relationship. However, these behaviors can become abusive and develop into serious forms of violence. Many teens do not report unhealthy behaviors because they were afraid to tell family and friends. That is not uncommon. Even in adult relationships, people are often very much afraid to reach out to someone when they need assistance until that relationship has become so unhealthy that it is now at a critical point and very aggressively violent. So you see some of those risk factors on the screen now: the sexual history, early sexual activity, the history of sexual abuse, non-existent parental supervision, family violence exposure, low self-esteem, depression, anger management issues, going back to that emotional accountability, social environments, the interaction with peers who engage in teen dating violence, participation in risky behaviors such as alcohol and substance abuse, growing up in a community that normalizes and accepts violence. If you can click to the next slide. I believe this is the video slide. We're not going to have a time to watch the video today, but we can put the link up there for you guys to watch it if you'd like. It's a little bit over 3 minutes, and it talks a lot about, at the beginning there, just people popping in and showing different ways, different examples that people sometimes use teen dating violence in schools, digital violence. They use social media to attack each other, or to be able to reach somebody. They'll take the phones from individual. They might make them share their location or their passcodes. There's a lot of peer pressure involved in a lot of these things. People might be telling other people what they can wear. They may be saying things all the time like, I love you, and if you loved me, you would do this. or they might say we should just break up as a way to control, to get the behavior that they want. The video also shows a victim towards the end of it who's speaking up, a survivor who's talking about her experience and the cycle of violence that she witnessed in her own life. I will share that link with it in the chat after the presentation. If we can go to the next slide. So the Safe Start approach. So what happens is that, violence is part of our fiber. We see it every day. I see it in the classroom when I'm presenting. I see it in the halls when I'm walking through it. We see it in TV and movie and music. And I was at a school yesterday even talking about how the culture all around us just helps to promote this. We often give some very bad qualities to our main characters in mainstream media nowadays. And those are the people that you end up rooting for, and how confusing that might be for individuals to be able to see that quality in someone that they're rooting for, and then to be able to know that that's unhealthy and not something they would want in a relationship themselves. Schools that collaborate with the Crisis Center and they invite the Safe Start coordinators to their schools, they closely align with the state's preferred model, talking about teen dating violence prevention. If we can go to the next slide. So the Safe Start goals. The goals of the Safe Start curriculum is to educate 7th to 12th graders about prevention techniques that can help them avoid relational and behavioral issues that typically result in violence. We actually don't offer just 3 plans anymore. I know that was something we did at the beginning, but we're learning that schools really have a lot of different needs. So we have 8 different sessions, and what we do is we allow the schools to pick which sessions work best for the population of students that they work with. And we want to improve students' violence literacy, assist them in developing risk avoidance and risk reduction behaviors, and encourage positive social emotional skills that lead to healthier relationships and interactions. So if we go into the next slide, these are the 8 different sessions that we have. I know that it says that they're approximately 50 minutes long, but that can be with a pre-test or post-test, which is not necessary, but it's just helpful for us to evaluate, but not all schools do that. We have schools that have behavior issues with technology. We have schools that have internet issues. So we don't always need that, but we really do like to have that feedback directly from the students, what they think of our presentations, so that we can make them the most engaging for them for the future. So we have schools that are approximately 40 to 50-minute long periods. We've even had some schools that would go an hour to an hour and 15 minutes. And sometimes we've planned a different activity to go along with something, or left a bigger time open for question and answers so that we could fill that time in the best way, the most useful way for the schools. So that first session, session 1, really helps to identify the violent thoughts and behaviors. We talk about the cycle of violence that can happen. We use a video that shows how quickly individuals could start dating and kind of get serious pretty quickly, and how unhealthy boundaries can slowly be introduced in a way that is not in any way as noticeable as you would think. And then before someone knows it, they are realizing that they're stuck in a very unhealthy situation. Session 1 is our the session that we probably give the most, and every school, with the exception of one, usually at least does session 1 for their presentations. These presentations can be in a classroom, they can be in an auditorium setting. We've presented to groups as small as 10. We've presented to groups as large as maybe 150 to 200 almost, depending on the school and how they choose to use the information. The second session is about strategizing emotional accountability, and we really stress how behaviors and thoughts and emotions are all connected. And that third one is responding to conflict. We give different styles of conflict management and talk about healthy communication. In the fourth one, that's the presentation I was telling you about yesterday, where we talk about how culture kind of warps our vision of what is a healthy relationship and what is beauty, and how we see individuals in mainstream that have these unhealthy behaviors and what happens to them, celebrities that are canceled or individuals that don't seem to receive consequences for their actions. In that fifth session, we talk about how to create healthy boundaries and how there are boundaries for every different aspect, how you set boundaries for your physical well-being, how you set them verbal boundaries, digital boundaries. We talk about all types of boundaries and what to do if someone's breaking your boundaries and what that can mean and how to address that. Our sixth session there is avoiding digital violence, and we talk all about how social media and technology has really become a big issue in how individuals choose to interact and how they can use those devices or those avenues in a very unhealthy way. Session 7 is deflecting gangs and human trafficking. We talk a lot about how some of those early risk factors that we were talking about early on into the session can also play a part in getting involved in gangs and how the need for relationships can be manipulated for human trafficking. Session 8 is all about advocacy, advocating for ourselves, advocating for others, and then all of additional resources to help with all of this. If you can go to the next slide. So the Safe Start presentation, the program is facilitated by trained staff, and we go into the schools ourselves. Myself and two other individuals have been doing that. The curriculum format, it can come in during a class session, so it could be that 40 to 50-minute class period. It can be in advisory periods. Most often, I think it probably is a health class, but we have had those special workshops. We have had individuals get something together after school even. We've gone to a few places to present there. We've also gone to parent and student sessions as well after school. The duration, that really depends on what the school chooses. If the school is like, I would really like to have that session 1, that basis session plus, these 2 other sessions, then we would work with our schedule and theirs to find a time. And they could pick, we have one school that has us come out 3 times in 1 week. We have one school that does all 8 sessions and we come once a week until we are completed with that. We work around all the days off. We try to pick days that work best for the schedule. We have some schools that have different scheduling. The amount of time of their periods is different days of the week. So we really try to be very flexible to work with everybody's schedule. We know that everybody is very different and every school is unique. If you could go to the next. Oh, and that last part, I'm sorry, the assessment. So that's again what we were talking about, where if the school is able to allow, in high schools, most of the time the kids have a phone with them. Sometimes people have a Chromebook or an iPad, and we ask the students to give us feedback about how our sessions go. We want to know as presenters, how well are we doing? How could we be better? And we also want to know about the information we're bringing to them. And they actually provide really great feedback. If you could go to the next slide. So I just got lost on my PowerPoint. I'm so sorry. So the Safe Start program's benefits. So what we see is that people feel more confident in their relationships, which then ends up making them feel more safe. It supports them academically because, again, if they're not feeling safe in those situations, they're not going to be able to learn information, retain information, and do well in their academic setting. They might actually have low self-esteem that prevents them from making friends, and keeps them from not even studying or thinking that they could do well in school. We have found that it increases positive school, the environment, people feeling more supportive of each other, because again, we do stress that although we're often talking about healthy relationships in the dating context, all this information really applies to friendships as well. And then this is in compliance with state and federal guidelines. The presentations have been approved to be taught in the classrooms to 7th and 12th grade individuals within the schools. If you could go to the next slide. Our goals are, we want to make sure that the kids are understanding dating violence. Again, we go through lots of examples of what that means, what they've seen, what they've experienced, what they've heard of. We want to talk about identifying individuals that mean to cause harm and what that looks like. And we want to take that honest approach to make sure that we are not the individuals that are causing harm. We want to recognize red flags that exist in unhealthy relationships. And we want to stop teen and dating violence even before it begins. If you can go to the next slide. So we're just going to give you a little bit of statistics about how our program has grown. So this is last year's statistics here. And during that time, we partnered with a total of 29 schools and organizations that received Safe Start plans and sessions. That was a 26% increase from the previous year. We don't have this year's stats all done yet. We actually still have schools that will reach out, and we might still even be adding a couple of people to the March and April months. In addition to this, to that school year, the Crisis Center for South Suburbia served more than 16,000 students and participated in 542 presentations last year. If you go to our next slide. Currently, we have done 319 sessions since September of 2025. But if we added nobody else to our schedule by the end of this year, we will have completed 522 sessions by the end of May. The number of students served currently, we have done presentations to 11,539 students. And again, if nothing changes by the end of the year, we are projected to have done presentations to 16,867 students. We are in 5 middle schools currently, 16 high schools. We've gone to 3 transition programs that are in high school settings, and we've gone to 5 different community organizations to present. And some of those schools, 16 high schools, some of those schools, we see both semesters. So if you were to individually count them, that would go up to 31 schools for the year. If you can go to the next slide. So by approving and implementing the Safe Start program, schools make a powerful commitment to student health, safety, and success. Again, we're working hand in hand. You know, we want to have a safe community. We want the kids to be able to recognize these things, not get into unhealthy relationships. We want them to feel safe at school, to be able to learn. We want them to make positive relationships and reach all of those goals that they set out for. So this initiative not only addresses a growing concern that we see in our schools, but also a foundation for relationships, healthy relationships. If you click to the next slide, that was some of the resources we used for some of our statistics and information. And if you click to the next slide, you'll see some of the feedback from the forms that we had the kids even use. We have some really sweet kids that often will talk about how this made them feel, what they learned, what they love. We found that unfortunately a lot of people are knowledgeable about, terms like love bombing and gaslighting because they've seen it more and more, which is wonderful that they know it and they can identify it, but just sad that we have to teach it and talk about it to keep them safe. There's more student feedback. There's some client and staff feedback at the end there. And that is all that I have for you guys today. I thank you guys so much for, again, letting us present today. And Kelly, I hope that you feel better soon.
Thank you so much, Melissa. This was fantastic information and much needed because I think things are a little bit different than it was when we were in high school, and
Absolutely.
it's an important subject. So I am very excited to have you here, and this was a treat. Does anyone
Thank
have any
you.
questions for Melissa? I hope that
I
you guys
also
contact. Oh, go ahead.
Yeah, I was gonna say, I'll put my email address in the chat along with the link for that video if anybody would like to watch it. And if anybody is interested in having us come out or would like to have a phone call or a Zoom or a meeting about any of the presentations, please let me know and let's see if it could work for your school.
Fantastic. I think any school would be honored to have you attend. This is great information. Again, thank you so much. Glad you could
Thank
take the
you.
time out to give us this information. If there are no other questions for any of our presenters, I want to thank you all for taking this time out on a cold Friday. It was very nice yesterday, and now it's freezing. And I hope to see you all next month when we welcome the Epilepsy Foundation of Chicago. They will share seizure information and school resources. Feel free to scan the QR code to get the registration for our March meeting. And also, if you are not signed up for our school monthly newsletter, which should come out in the next 2 weeks, please scan the QR code at the bottom of the screen. The top of the screen, you can have access to all of our registrations for the rest of the school year ending in May. And we hope to see you soon. For those who may have joined us late, I did get some emails this week that you still have not gotten those CEUs, and I am mortified. I will continue working with Heartgrove to see what is possibly the problem and how I can assist in rectifying it. That is not normally how I put on production, so I'm mortified, but rest assured, I am working on it. Thank you all so much. Enjoy your weekend, and we will see you next month. Be well. Thank you.